make sure. Okay, everyone's muted. All right. If everyone could go on mute for now, just so we don't have any background noise. But I just wanted to say thank you everyone for joining the 2026 open enrollment for Invo Healthcare. Today we'll go through a couple important things. We're going to talk about open enrollment and what you should expect, eligibility rules. We'll go over your 2026 benefit plans, look at those premiums, and then we'll kind of go through quickly how you can update your benefits in UKG if you'd like to, and then talk more about what that looks like at the very end, and then hold some questions for the end as well. Like I said before, if you weren't on, if you would like to put your questions in the chat box, feel free. I have Donna Guess here from from Gallagher. She's manning the chat, and then also Nate will be helping her in the chat. He is on the Imagine Health side, and we'll talk more about who Imagine Health is down the road in this presentation. But again, welcome to your 2026 open enrollment. This is your annual opportunity to make any changes to your benefits for the new plan year, and that new plan year is January 1st, 2026. During this time, you can change or opt out of coverage. You can choose new options if there are any. You can enroll eligible family members, enroll in coverage if you're not already enrolled. And then you can also participate in the FSA because that is something that you have to re-enroll annually if you want to be in that. This year, we're having a passive open enrollment, and that basically means if you don't go into UKG, anything that's currently your benefits as of this year of 2025 will transition into 2026 in the new year. So if you're currently enrolled in plans and you don't log in to UKG, those same plans will be your insurance for next year. And also, if you're currently not enrolled in any plans and you don't log in to choose any plans, you will not have health insurance for 2026. So just want to make that note because it's super important. If you want to make any updates, you got to go in UKG, and you have until December 14th to do so. Once you make all those changes, a note will get sent to your HR team and they'll approve it. And then those benefits will be effective January 1st, 2026 through December 31st, 2026, and they'll remain in effect unless you experience a qualifying event. You and your dependents are eligible for these benefits if you work a minimum of 30 hours a week. Those benefits will go into effect the first of the month following 30 days of your full-time employment. Eligible dependents will be your legal spouse, children up to age 26, and any disabled dependents of any age. Like I said before, elections made now will remain until next open enrollment, which would be next year. Unless you guys experience a qualifying event. And if you do experience a qualifying event, notify your HR immediately. You do have 30 days to notify them, but it is better to just get the ball rolling and notify them as soon as that event happens. And those events examples are marriage, divorce, birth or adoption, loss of eligibility. So if you're on your spouse's plan right now and they lose eligibility so then you lose coverage, you can opt to enroll into Invo's plan or vice versa. If you lose eligibility at Invo and your spouse has a plan, you can go onto their plan as well. The things that are not changing this year are the UMR and HealthScope medical plan designs, the Kaiser Hawaii HMO plan design, the UHC vision and dental benefits, all of your Lincoln benefits, so that is life, disability, worksite like accident and critical illness, and your EAP, Your HSA vendor is not changing, as well as WEX for your FSA, and then your 401k will continue to be through Schwab. There are a couple of things that are changing for January 1st, 2026 plan year. That is employee contributions on certain plans. So those plans will be the UMR plans, the Kaiser, California, and Hawaii plans, and the UHC dental plans. And that doesn't mean the plan designs, that just means the premiums that you pay for those plans. There are small increases to those. Your HSA limits are changing for the new year. For an individual, that's $4,400, and for a family, it's $8,750. For your FSA, the limits are increasing to $3,400 for an individual and $7,500 for a family. For your HSA, we'll get into it more later, but Invo does contribute $600 annually to an employee-only account, and then I believe $1,200 for all the 3 other tiers of family. So if you're enrolled employee spouse, employee children, or family, you'll get $1,200 into your HSA account from Invo. The 401k contribution limits are also increasing. The IRS dollar limit is increasing to $24,500. And then you also, if you're 50 or older, you get a catch-up contribution, and that is going up to $8,000. So a little bit about the medical plans. They are not changing from last year. Actually, sorry, I spoke too soon. The Kaiser California plans are changing slightly. The carrier is staying with Kaiser, but the plan design features have some change, and we'll go over that in a second. But any employee residing in the continental US have the choice of 4 medical plans. They can choose the UMR high deductible health plan and the UMR copay plan, and they can choose the HealthScope high deductible health plan and the HealthScope copay plan. Employees residing in California have 3 options: the Kaiser in-network only plan, that's a high deductible health plan, the Kaiser copay plan, and a buy-up Kaiser copay plan. Employees in Hawaii have access to 3 options: the Kaiser in-network only copay plan, the UMR copay plan, and the HealthScope copay plan. All right, so before I get into the details of these medical plans, I kind of want to set the stage of how HealthScope reference-based pricing works compared to your UMR PPO copay or UMR PPO plan. So these carriers, they act the same in the sense that they cover the same services. So all of these services that you see on here, they're going to cover them in a similar way. It's just on the back end, HealthScope, you have no network necessarily, so you can go to whatever provider you want. That doesn't necessarily mean they'll accept it. You might have to fight them a little to get them to call the carrier to see how the carrier will pay them. But typically, once they understand how the plan works on the back end, they take the plan. So the way HealthScope works is, instead of charging a discount for services like UMR would, and instead of having a certain network that you have to go to, you can go to any provider in your area or in any area in the US, and you'll pay whatever the contracted rate is. But on the back end, which you will never be involved in, they charge the doctors, the carrier charges the doctors a percentage of Medicare. So they'll charge the cost plus, let's say, for example, 30%. And Nate, please jump in if I'm not saying this correctly. I know you're the knowledgeable one about this because you do this every day. But
I think you're doing great. So
okay, good. So you'll pay whatever the contracted rate is that HealthScope has with that certain provider. And on the back end, instead of the provider and the carrier working out some sort of discount, the carrier is going to say, we think this price is fair and reasonable for you to charge your patient, and this is what we're going to cover, and like, let's agree on this price. So let's say you go to your primary care on the HealthScope plan and you pay $100 for that service, versus on the UMR plan, you may pay $50 for that service. The HealthScope plan is gonna be a different rate at each provider that you see, because there's gonna be different contracts in place for those providers. Hoping that that makes sense. But on your end, you don't have to worry about anything such as costs to you. You just really have to worry, if you're going to enroll in the HealthScope plan, you need to educate your doctor or the front desk person at your provider's office to tell them what your plan is. And if they don't understand it, or if they say, we don't accept this, please have them call the number on the back of your ID card to talk to a HealthScope customer service representative. They'll talk to each other and they'll get on the same page about how the plan works. And then typically we've seen it pretty much every time where the doctor accepts the insurance, because they now understand how to bill the carrier. They now understand how to bill you. But that's kind of how it works. Does anyone have any questions so far?
I think
I
we'll
have
just
a few questions. I'll just wait till the end.
Go ahead.
Okay.
I was just going to add, Mackenzie, to a part of this conversation, like talking about RBP guys, is the kind of the cost to you on the paycheck deductions. So you'll see kind of how on the screen that Mackenzie's sharing, the reference-based pricing plan through HealthScope versus the UMR high deductible health plans. The calendar year deductible is going to be lower, and also the biweekly paycheck deductions are going to be lower as well. The other thing you'll notice is that many of the benefits that you see down the line here on the summary plan description are exactly the same versus each other. So it's going to be lower costs on the reference-based pricing plan to you paycheck to paycheck, and also your deductible is going to be lower, but you're going to get the same benefits. Usually, a lot of people might overlook that, but I will say, and I'll kind of speak from experience, off the bat, reference-based pricing can be a little bit confusing. However, it is going to work like any other health plan that you're on. Everybody here on the Imagine Health side is also on reference-based pricing plans. I myself have been on one for 6 years. And when I go for my doctor's appointments, what I do is I just hand them my ID card and I say, here's where you can send the bill. 9 times out of 10, there are no questions asked, and the benefits are going to be exactly the same that you see here. But if there's ever a provider that does have questions about the plan, usually it's because they want to know where they can send the claim so that they can get paid. And that's something that we want to honor and want to give that to them so that they know how to process those claims. So that's kind of what Mackenzie was talking about. It's going to be a little bit more work on the RBP side, which is reference-based pricing, but it is going to be a lot more savings for you guys. So it's really good to consider that plan.
Thank you, Nate. That was awesome. I think somebody else might have had a question. Nope. Okay.
Yeah, there's nothing in the chat.
If anyone does think of something, feel free to raise. There's like a button that says raise hand. That'll be the easiest. Or like I said, put your question in the chat if you have access to it. All right, so I'm now going to go into how a high deductible health plan works. So high deductible health plans are different from a normal copay plan, and that's because it's a deductible driven plan. So until you meet your deductible, you're going to pay out of pocket a contracted rate that provider and the carrier have with each other, and that contracted rate that you pay for a specific service is going to go towards your deductible. So on this option 1 health scope plan, as an individual, you're going to have a $1,700 deductible. And as if you're on the any family tier, you're going to have a $3,400 deductible. So as an example on this plan, if you see a primary care specialist and let's say it's a $50 copay, you're going to pay that $50 copay. And it's going to go towards that $1,700 if you're an individual on the plan. If you're a family, it'll go towards the $3,400. And then every service that you receive, so let's say maybe you have an inpatient service, like you're having a big surgery, you're most likely going to meet your deductible for that one service because surgeries are very expensive. So once you hit that deductible, you're only going to pay 35% of whatever the cost was that the provider was charging you. So that's your 35% coinsurance. That's a really important thing to know. Coinsurance is the amount you'll pay once your insurance carrier starts to help you cover the cost of things. So then once you meet your deductible, you start paying 35% of those costs of whatever those services are. That 35% cost is going to contribute to your out-of-pocket limit. So for an individual on this plan, it's $3,400, and for family, it's $6,600. And then, so basically you'll pay 35% of the cost. That goes towards the out-of-pocket maximum. Once you meet either of these limits, you'll have your services that are covered under this plan will be free for the rest of the plan year. So for example, a friend of mine got 2 shoulder surgeries this year. He immediately hit his out-of-pocket limit of the $6,600 because he has a wife and he would be on that tier. And his wife also had a knee surgery. They immediately hit their out-of-pocket limit, and they now when they go get any service done, they don't have to pay anything. So if you are a healthy person and you don't really go to the doctor a lot, I would say a high deductible health plan is the right plan for you because it's going to have the lowest cost monthly on your premiums. You're going to have probably slightly more out-of-pocket expense, but you're going to have the lowest premium cost. And the same thing happens on this option 2 UMR plan, although the deductibles and out-of-pocket maximums are different. And this plan also has an out-of-network coverage. So for the UMR plan, this plan does have a specific network that you have to go to. And you can look up that network on myuhc.com. But with this, if you're an individual, you have a $3,000 individual deductible and a $6,000 family deductible. Once you meet those limits, you'll pay 35% coinsurance. And then once you start paying 35%, you'll have to meet the out-of-pocket limits, which are $8,000 for an individual and $16,000 for family. For both of these plans, you have, you can see you have tiered copays for your pharmacy. You will have to meet your deductible, your medical deductible, before those copay tiers kick in. And then you can see the biweekly payroll deductions here. For option 1, you can see it's a lot less expensive than option 2. And like Nate said, you're just going to get more value out of the health scope plan because of the way they charge providers and how they negotiate bills on behalf of you. Any questions so far?
We're good in the chat. We had
Okay.
a question, but we answered it already.
Oh, good. Okay. All right. The next 2 plans, they're still with HealthScope and UMR. These are copay plans. So these work differently than the 2 plans we just talked about, but as I said, the reference-based pricing, the health scope plan, that is going to be your more cost-effective plan, and you're going to get more value out of it because you're going to pay less out of pocket than you would on the UMR plan. On this plan, though, on option 3, there's 2 tiers, and that depends on where you live in the US. So you can see down here in the notes section, tier 1, you can see all of these cities: Orlando, South Florida, Chicago, Houston, El Paso, Dallas, all of these. If you live in these areas, your ID card will have the network that says Imagine. If you're in a tier 2 zone, that's all other providers. That's going to be any other city outside of these that are listed. But that doesn't mean for the tier 1, that doesn't mean you have to go to these tier 1 incentivized providers. What these tiers mean is, if you live in those areas, there are incentivized providers that you can go to where you'll automatically have a lower deductible, lower out-of-pocket maximum, lower coinsurance, and lower copays for services. So this doesn't prohibit you from seeing any provider you want. You can still go see any provider you want, but if you're in those areas, you can absolutely go see an Imagine Health incentivized provider and get somewhat of a discount seeing them. So tier 1 will have a $250 individual copay and a $500 family copay. Tier 2 will have a $500 individual deductible. Sorry, I was saying copays, and a $1,000 family deductible. The coinsurance for tier 1 on this plan is 15%, and the coinsurance on tier 2 is 35%. Your out-of-pocket maximum for tier 1 as an individual is $1,250, and as a family is $2,500. For tier 2, it's $1,500 for an individual and $3,000 for a family. Now on this plan, both these plans, you can see there are copays for certain services. That means if you see a tier 1 provider, you'll have a $15 copay every time you go there. You won't have to question what that is, like the other plans we previously talked about, where you don't necessarily know what you're going to be charged when you get there. And it's most likely going to be a lower copay on this plan than the high deductible health plans. So if you're on tier 2, you'll have a $30 copay. And then for specialists, tier 1 is $40, tier 2 is $55. If you go to an inpatient or outpatient provider, tier 1 is going to pay 15% of the cost after you meet your deductible. And then for tier 2, 35% after you meet your deductible. And then your diagnostic testing, tier 1 and tier 2 are the same, 15% after your deductible and 35% after your deductible. Urgent care, you're always going to have a copay of $15 for tier 1 or $50 for tier 2. And then your prescriptions, you do not need to meet any deductible. You'll immediately start paying these copays per tier. So it'll be $7 for generic, $45 for preferred brand drugs, $75 for non-preferred brand drugs, and 50% for any specialty drugs. So you'll pay 50% of that cost, and the carrier will pay the other 50%. For the UMR PPO copay plan, this one works similar. You have your $2,000 individual deductible, $4,000 family. This one has a 35% coinsurance, and then your out-of-pocket maximum is $7,500 for an individual and $15,100 for family. I also want to note, I don't think I mentioned this before, but preventive care is always going to be covered with an in-network provider on the UMR plans, and it'll always be covered at any provider you see on a health scope plan. So for primary care and specialists, you'll have $30 copay and $55 copay. Inpatient and outpatient visits, you'll have to pay 35% of the cost after you meet your deductible. Same there with the labs and radiology, so your MRIs, CAT scans, PET scans. Urgent care is $75 copay, emergency room 35% of the cost after your deductible. This plan does have a small deductible for the pharmacy, so you'll just have to pay $100 as an individual or $200 as a family if you choose to be on the family tiers. After you pay one of those deductibles, you'll have the copay tiers, the $7, 45, 75, and then 50% for specialty. This plan does have out-of-network benefits. So if you do enroll in this plan, I don't recommend going out of network because you're never going to get the best bang for your buck. You're always going to be charged more out of pocket, and in the end, it will it'll increase the plan premiums each year, and it also increase your out of pocket expense each time you see an out of network doctor on the UMAR plan. But just know that is available for things. I know that when people have to go get special treatments or go see certain specialists, you have no choice but to go out of network. So that is an option on the UMR copay plan, as well as the UMR high deductible health plan. For the health scope plans, you can see any doctor you want and you won't have to worry about having a separate out of network cost for that. As you can see, these payroll deductions, the health scope plan is less expensive than the UMR copay plan, and that is for a reason. I've said this before, but I know we have some new people that have just joined the call. You're always going to have more value being on the health scope plan, and you're always going to pay the least being on the health scope plan for your services and for your monthly or bi-weekly premiums.
We have a question for you, Mackenzie.
Yes.
Okay, the question is the comparison between option 1, choose any provider, not sure how much things will cost till after the insurance review rate with the provider, versus option 3, where you have a list of providers in network with already stated amount for service.
Yes. So option 1 is considered a high deductible health plan. That means like all providers with your insurance are going to have different contracted rates. So you can call the provider before you go to that to get that service done, and you can say, hey, this is my insurance, I'm on a high deductible health plan, what's your charge for this type of service? And they'll tell you, or you can show up and ask the same question. I would recommend calling before just so you're aware and prepared, versus option 3 is a copay plan. So certain services on here will always have a set copay, so you'll never have to guess what you'll owe when you go to the doctor. So you'll always pay that certain copay. For example, your primary care, if you're in tier 1, every time you go see your primary care doctor, you're paying $15 if you're in the tier 2 or tier 1 and $30 if you're in tier 2. Versus option 1, if you go to primary care provider A, you may pay $50 because that's what they've agreed to pay with your carrier, versus if you go 10 miles down the road or 5 miles down the road and see provider B, they might have a different contracted rate that's $65. So a high deductible health plan, it's more so something that you have to do your homework with if you'd like to, where you can preemptively call your doctors and say, hey, I'm on a high deductible health plan. What's my charge going to be when I see you? Versus the copay plan where you're aware of what that is. Did that make sense?
He said
Okay.
yes.
Great. Any other questions? Jessica, I feel like I saw you light up.
I have a new one here. Does anyone here have experience using the RBP with well-known medical entities such as Baptist, etc.? I chose the UMR last year because everyone I called said they don't take it. I understand what y'all are saying to do, but what if your providers don't want to negotiate? Good question.
So
I had that.
sorry, say that again.
I chose that plan this year, and I've had a horrible time, particularly with Baptist.
Oh, really? Nate,
Yeah.
I don't know if you know off the top of your head, does Imagine not work with Baptist much?
So as far as the Imagine Health Network, I'd have to verify if Baptist was in that. But what I can say on RBP in general is that depending on the provider that you go to, whether it's a new front desk person or if it's somebody that it might just be looking at that ID card and is not sure what it is, because it's a different type of insurance, right? Sometimes they have a little bit more questions. So because
I mean,
the Oh, sorry, go ahead.
to be transparent, I spent lots of hours on the phone with all the people through the insurance company and even and still have not had success.
Have you reached out to HR to help, like ask for help? Because if you did, hopefully, I haven't seen your name anywhere, but we're happy to help figure out all of that on your behalf.
Okay. Yeah, I did. I still have several providers that I'm paying private pay.
Can you send those provider names to the HR team so that they can forward it to us and then we can kind of do our due diligence and see what's going on?
Yes.
Okay, thank you. Yeah, because typically most of the time when people have sent their provider information, we've been able to kind of like get kickstart it or get to the problem faster because sometimes when you call the customer service lines, although that is the main number you should call, there are people on the other end of the line that might not be trained as well. So if you're ever having any problems, I always say, don't try to do it yourself. Ask for help. I'm bad at it. I don't like asking for help. But with the RBP especially, I would say ask your HR team for help. They'll send your information to us and then we'll kind of do the work on our end so that you're not so frustrated and pissed off about it, which is fair that you are.
Yeah, just send that to HR and ask her to forward to Mackenzie.
Yeah. Okay. So if for some reason your providers say like, hey, we will not work with HealthScope, we will not work with a reference-based pricing plan, and you are on that plan, then you'll most likely have to find a new provider, which I know is not always best case scenario because sometimes when you finding a good provider is hard. I've experienced it myself. So, like I said, if you're ever having any issues, contact your HR team. They'll contact us and we'll get right on it to see if we can find a solution quickly. But I'm going to move on to the next couple slides. It's still going to be talking about reference-based pricing, so maybe it'll help more. And then we'll get into the Kaiser plans as well. Oh, sorry. I said that wrong. We're going for Kaiser plans now. We'll go over Kaiser California and Kaiser Hawaii, and then we'll go into more reference-based pricing information. But if you're in California, you also have an option to enroll in Kaiser California plans. These are the only 3 plan designs that we changed a little given the increase we got on the plans. So the deductibles and out-of-pocket maximums are increasing slightly, but I do think that most of the copays went down at least like $5 to $10. So on the far left side, you have your high deductible HMO plan, that means there's no out-of-network benefits. So you can only see in-network doctors, and these plans work like a normal carrier does. You'll have a $3,400 individual deductible and a $6,800 family deductible. This plan is 30% coinsurance, so that means once you meet your deductible on the certain services, you'll pay 30% of that cost. Once those costs go towards your out-of-pocket maximum, which is $5,350 for an individual and $10,700 for family, you'll then not be charged anything for any of the services that are covered under your plan. So for example, primary care and specialist visits on this plan, you'll have to meet your deductible before paying a $30 copay or a $50 copay. Same with inpatient and outpatient, you'll have to meet your deductible before paying 30% of that cost. X-rays and labs, you'll meet your deductible and then have a $10 copay. And then MRIs, CAT scans, PET scans, MRAs, you'll meet your deductible, pay 30% of the cost, but you'll never pay over $150 for that service. Emergency room and urgent care, you'll meet your deductible and then pay a $30 copay. Emergency room, you'll meet your deductible and then pay 30% of that cost. For this plan, you do have to meet your medical deductible before your pharmacy tiers kick in. Once you do meet that deductible, you'll have a $15 copay for generic, $30 copay for brand drugs, $30 copay for non-preferred brand drugs, and 20% of the specialty drug costs to a maximum of $250. Next, in the middle, you have an HMO copay plan. So you'll have a $2,500 deductible for an individual, $5,000 deductible for family. Your coinsurance on this plan is 20%. Your out-of-pocket maximum is $5,000 for an individual and $10,000 for family. Specialists, primary care and specialists, you'll see it's different from that high deductible health plan we just talked about. You just have a $25 copay and a $35 copay every time you see any specialist or any primary care provider that's in the network. Inpatient and outpatient services, you'll meet your deductible, then pay 20% of the cost. X-rays and labs, you'll meet your deductible, then pay a $10 copay, and so on. This plan and the next plan, you do not have to meet your deductible before your prescription drug copays kick in. So you'll just have those copays when you fill your prescriptions. The last plan on the right is the $750 HMO plan. This is also a copay plan. So the deductibles and out-of-pocket maximums are just lower. It's the richest plan, so it'll be the most expensive plan, but here you'll have a $750 individual deductible and a $1,500 family, 20% coinsurance, and then $3,000 individual out-of-pocket maximum and $6,000 family out-of-pocket maximum. You'll have copays for things like primary care and specialists, urgent care and emergency room, and as well as your x-rays and labs. And then for things such as your MRIs, CAT scans, inpatient, outpatient services, you'll meet your deductible and then pay a percentage of that cost. Like I said, no, you don't have to meet your deductible before your pharmacy prescription copays kick in. And this is slightly different than the other two plans. $10 for generic, $30 for brand, $60 for non-preferred brand, and 20% of the specialty drug cost up to a $250 max. And then you can just see your bi-weekly payroll deductions. You're gonna pay less monthly for the high deductible HMO plan. That's the $3,400 individual. And then you're gonna pay the most for this far right plan with the $750 deductible. Oops, sorry. And if you are in the Hawaii area, any of the islands, you have the option to enroll on the Kaiser HMO plan, the HealthScope copay plan, and the UMR copay plan. You are not eligible for a high deductible health plan in Hawaii, so these are the only 3 options you have available to you. For this Kaiser plan, we haven't reviewed it. It does not have a deductible. You do not have any coinsurance, so therefore, you'll pay your primary care specialist $15 copay. You'll pay a $15 copay for labs and radiology, and a $15 copay at any Kaiser urgent care facility. For things such as inpatient and outpatient, you'll pay 20% of that cost. Since you don't have any deductible, you don't have to meet your deductible. And then those payments will go towards your out-of-pocket maximum limits. And once you meet those limits, you'll not have to pay for anything on that plan. The next 2 plans I previously went over, but does anyone have any questions on the Kaiser plans? Okay, great.
Yeah, nothing in the chat.
Okay, awesome. Okay, so UMR customer service. There's a couple different ways you can connect with someone. You can call the number on your ID card. That is available to you 24/7. You can sign on to your UMR mobile app, or you can go on to the website at umr.com and you can do live chat for customer service. You can also go online and do secure messaging. So that's basically maybe if you want an explanation of benefits or any type of secure document, you can go onto your portal at umr.com, click contact us icon, and then you can send your documents and receive documents securely. I briefly mentioned the UMR mobile app. That's available to you if you do enroll on either of the UMR plans. This will give you access to your ID card. So if for some reason you don't have an ID card, or if you lose your ID card, you always have it on your mobile app. You can also research things to, stay on top of your health. You can look up in-network healthcare providers. You can see pricing for certain appointments. You can also see how many medical claims you've had in the year so far. So typically it gives you, like, let's say you have a $3,400 deductible, it'll tell you you've paid $1,500 towards your deductible. So you can kind of keep an eye on it and see when you're about to hit your limits. The UMR mobile app also has any chat, calls, or messaging to get in touch with any UMR customer service team. Your HealthScope resources. So as we talked about before, HealthScope is different. It works differently than UMR on the back end. It looks like a normal carrier plan on the outside from your perspective, but on the back end, things that you guys don't need to worry about. It doesn't combine you to a network, so you can go see any provider. But also, the way they charge on the back end is a percentage of Medicare rates. Instead of getting a discount for being with UMR or getting a discount for being with Blue Cross Blue Shield, Aetna, Cigna, they will negotiate the price on your behalf, and they'll negotiate it against Medicare rates. And that is why it brings more value, because you're always going to pay less than you would on a traditional insurance plan. If your provider does not recognize your plan, if they're confused, please push them to call the number on your ID card. A lot of times the front desk person they honestly probably don't have any education on insurance. They kind of just go through the motions and they know what they accept in their head, but if there's any changes, they're lazy sometimes. So you really need to push your front desk people at your provider's offices to figure out how the plan works. They can call the number on your ID card, or if you're having any issues, or what I recommend is before you go to any doctor's visits, pre-plan. So in the beginning of the year, if you're enrolling on the HealthScope plan, go research providers within however many miles away, like let's say a 5 mile distance from where you live. Research those doctors, call them and say, hey, this is my plan. If you're in the tier 2 network, you say Imagine Health is my network. If you're in the tier 1 network, Imagine Health. If you're in the tier 2 network, it's HealthScope. And say, this is my plan. Can you call if they say, great, we take it, that's awesome. Then you have nothing to do. If they push back and say, we've never heard of that, we're not using this, give them the phone number, tell them to call, and then have them walk through it with a HealthScope customer representative. If you are overcharged for a service, so if you go to the provider's office, they accept your insurance, they charge you your copay, and then they bill you later on, that's called a balance bill. That can happen with any carrier, not just HealthScope. It can happen with UMR, it can happen with Cigna, it can happen with anyone. But if you do get a bill in the mail, immediately call the number on your ID card or send it to your HR team. Calling the number is faster. They will immediately work on that bill on your behalf to try to figure out if you even owe any money. And if they do figure out you owe any money, they'll make sure to negotiate to the best price on your behalf. So it's super important that you don't sit on those bills. You don't want to get sent to collections, and let someone know about it. This is just an example of how HealthScope works compared to UMR. So on a standard insurance plan like UMR, the claims are paid on a discount of the billed charges. Billed charges just means what the provider bills for your visit, and that's what UMR would receive on their end. They would then discount those billed charges, then they would cover a certain amount, and then they would charge you the rest of the amount, and that would be what you owed for that visit. On HealthScope, the claims are paid based on the use of the cost. So based on the cost of the service plus any Medicare amount percentage, and that will offer you a fair and reasonable price, which results in more savings, which we've talked about previously. This example is based on a dialysis cost share service. So you can see Hospital A, the average billed charge for dialysis is $2,003. The actual average cost of that service is around $102. Medicare would pay $150, and the UMR plan would pay $1,002. So therefore, if you were on this Medicare plan, which is the HealthScope plan, you would automatically be saving much more money than you would be if you were on the UMR plan. Same thing here in B and C. Hospital C example, average billed charges are $4,451. The average cost of the service is actually $87. The HealthScope plan Medicare pays $153. The UMR plan would pay $2,226. So your reference-based pricing plan, which is your HealthScope plan, would pay $184. So that's like significantly decreased amount compared to any basic UMR, Cigna, Aetna, Blue Cross Blue Shield plan. Does that make sense?
Yes. One question on this page, it mentions ELAP, and I think everybody needs to know that that is the same thing as HealthScope, right?
Oh, yes, that was a typing error on my part. I'm sorry, everyone. That should say health scope. Oops. So, sorry for the confusion.
They mean the same thing.
Yeah. I see someone typing, but I haven't seen anything yet.
Here it comes.
There we are.
It says
For
for
health scope
HealthScope,
tier
are-
1, will there be a list of providers that we can reference that will accept the insurance to avoid the trouble of calling each office? Do not want to go through the trouble like other employers. Nate, are you still on here?
yes, he is.
Yep,
Oh yeah,
still
there he
on.
is.
So
Do you guys have a list of those providers?
As far as the Imagine Health providers, that's something that you guys can access within the Imagine Health provider search
that's
tool.
right.
That's in your benefit
Yes.
booklet. When it comes to providers that are historically like they accept HealthScope reference-based pricing, that would probably be a HealthScope question, which should also be in your benefits booklet. So Mackenzie, you might be able to pull that from HealthScope directly.
That's right. Yeah. So, there is a way to look up providers on HealthScope and Imagine, and that it's different than when you would look up a provider on UMR. If you look up a provider on UMR, you know that those providers are in network. If you look up a provider on Imagine Health or HealthScope, you'll see certain providers pop up, but if you don't see your provider pop up, that doesn't necessarily mean they don't take your insurance. It just means they might not have worked with reference-based pricing plans before. And then that would kind of trigger you to call them and say, hey, I don't see you are listed on my my insurance carrier's site. Can you call this number and work with them to figure out how the plan will work so that I can make an appointment to see you? Does that help?
It does. It helps. Know that
Okay.
you don't take it.
Great. Awesome. If your spouse gets a new job and you go on their health insurance, do you just call?
Okay.
That counts as a special event if it is within the next 2 months. So if you enroll on this plan and then your spouse becomes eligible for their plans, that is considered a qualifying event.
So
And
I'm
you,
listening to this
I think
thing.
I think
It's 8
someone's
o'clock
not
now,
on
and I'm
mute.
like really trying to be done
Jessica,
with it. But essentially, there's
Jessica, I think you're not on mute. Sorry.
You there? Hello?
Here, let me try and mute you. How do I do that? Oh, there we go. Okay, she's muted. So if your spouse is eligible for benefits in the next 2 months, then yes, that would be considered a qualifying event. And if you prefer to be on their benefits, you can drop your coverage. You just have to let your HR team know within 30 days of that event. So as soon as they become eligible, or as soon as they enroll you guys, let your HR team know, and they'll be able to help you get off the plans, and vice versa. If your spouse wants to come onto your plans, that's a qualifying event too. Yes, you can look up the HealthScope providers. I believe it's in your benefit guide. So you can go on to imaginehealth.com and look up your providers to see if they're on there. If not, you can send a list of providers to your HR team and just ask them to forward it to us, and then we'll do our due diligence in checking. But I would recommend going on the website first just to see. But don't freak out if your provider is not on there. It just means they might not be working with them yet. So they'll be most likely be willing to work with them. I think there's only been like 1 or 2 providers that have pushed back and not wanted to work with someone. So it really doesn't happen often. I think we're good. Is there another question?
No, I was waiting towards the end, but
Sorry.
if everybody, yeah, don't
Can
worry.
you please confirm the site? There are so many organizations, but not specific categories for California area. Hard to see what it is. Nate, are you able to put the site in the chat? I don't have access to that right now.
I can go ahead and put the site in the chat. Give me just a second.
Thanks. All right, I'm gonna move on because I know it's getting late. We're at time here and we've kind of got some more stuff to get through. TrueScripts will continue to be your pharmacy benefit manager on the UMR and Health Scope plans. So if you need anything, ID cards, they'll have this information on your card. If you're a new enrollee for the new plan year, an ID card will be mailed to you. If you're not a new enrollee and you're not enrolling in a different plan, you'll keep your same ID card. That'll have the TrueScripts pharmacy billing information on it. You can go on their member portal. That's memberportal.truescripts.com, and you have 24/7 access to your plan information. You can look up claims history. There's lots of tools and resources that you can go on there. If you ever need any advice or help finding a prescription for a cheaper price, TrueScripts is your people to call. If they're not already working on finding you a prescription that's more cost effective for you, then call them. But they're very proactive, and they monitor all the claims data that comes in for Invo, so they already know what people are taking, and that triggers them to do their research to find more cost effective drugs for you.
I'm sorry, Mackenzie, did you say that everybody would be getting a new ID card?
No, only if
okay.
you enroll in any new plans, or if you switch plans, or if you're not enrolled right now and you enroll in the new year, you'll get an ID card.
Thank you.
Yep. Your HSA bank is through Optum. To be able to contribute to an HSA, you have to be enrolled in a high deductible health plan. You cannot be covered by any other insurance plan that's not a high deductible health plan. You can't be enrolled in Medicare, TRICARE, or TRICARE for life. And you also cannot be claimed as a dependent on another person's tax return. I said this earlier in the presentation, but Invo contributes $600 annually to the employee-only tier and $1,200 to the family tiers if you're enrolled in an HSA. And for 2026, the maximum limits that you can contribute to your account is $4,400 for a family and $8,750 for a family. $4,400 for an individual. Apologies, I'm talking too fast, clearly. If you are 55 and older, you can do a catch-up contribution and add in $1,000 extra. Also, you can make changes to your contributions throughout the year. So if you decide now you want to contribute $10 per paycheck, and then you decide you want to contribute more, you can update that in UKG throughout the year. It doesn't have to be during open enrollment. If you are not on a high deductible health plan and you're on any of the copay plans, that includes the Kaiser plans as well, you can enroll in a flexible spending account. This is a tax forward program, and it allows you to pay for healthcare expenses that are out of pocket with pre-tax dollars. So this is different from a health savings account. You can focus on health savings versus flexible spending. So savings is kind of like a retirement account. With an HSA, you can put money in that account and you don't even have to use it ever until you retire. You can take that money out when you retire on a pre-tax basis and, have that savings. With the flexible spending account, this is a use it or lose it account. any money you contribute to this account, if you do not spend it by the end of the year, you will forfeit it. So Invo will take the money at the end of the year. So it's super important that if you enroll in this account and you're putting money in, you, number one, put a lump sum amount at the beginning of the year. So it's not taken payroll deducted. You'll put, let's say, $1,000 in at the beginning of the year. Make sure you use that $1,000 throughout the year, because come December 31st, you won't be able to have access to that money unless you qualify for the grace period. Then you'll have the extra 2 months at the beginning of 2026 to use that money. After that, it's gone. Invo takes it and it's gone. So please make sure that if you're enrolling in this flexible spending account, you're using the money within the time period. I think we have more questions. Can you please repeat the 3 health insurance options for Hawaii? Yes, I'll go back to those. Okay, so for Hawaii, you have access to the Kaiser HMO plan. That's a $0 deductible plan. Your out-of-pocket maximum is $2,500 for an individual. For a family, it's $7,500. The primary care and specialist copay is $15. You'll have to meet your deductible and then pay 20% of the cost for inpatient and outpatient services. Same with your MRIs, CAT scans, PET scans. For lab services and x-rays, you have a $15 copay. Urgent care, $15 copay if you go to a Kaiser facility. If you don't go to a Kaiser facility, but you still go to an in-network doctor, you're gonna pay 20% of the cost after you meet your deductible. Same with the emergency room. And then your pharmacy copays are $3 to $10 for tier 1, $45 for tier 2 and tier 3, and $200 for tier 4, which is usually specialty drugs. The other 2 are the HealthScope copay plans and the UMR copay plans. Does that help,
Yeah.
hopefully?
Yeah, those are the same 2 plans everybody else has.
Yep.
And then there's another question, and I think Nate's writing, but it says, now I'm confused about the difference between just
I can go ahead and
hold
answer
on.
this one,
Oh,
Donna.
thank you.
Okay, so
So
everybody sees the
for-
question. Now let's read the question. So I'm confused about the difference between Imagine Health and HealthScope. Of our 4 options, 2 say HealthScope and none say Imagine Health. Go ahead, Nate.
So I just wanted to give some clarification on the Imagine Health piece of the HealthScope plans. So HealthScope obviously works on their own plan. This is a reference-based pricing plan for Invo. With those HealthScope plans, there is what's called a Imagine Health Network built into those. And that is to give some more provider access to members that are within that Imagine Health provider footprint. So depending on where you're located, I know we've got some people in Florida. I think we got some people in Pennsylvania too, right, Mackenzie, or New Jersey?
Yeah.
So in
Both.
like Philadelphia and New Jersey specifically, and then also in Tampa, Florida, and in Orlando, there are a lot of members that are within that Imagine Health footprint. And these are providers that we partner with here at Imagine that we've already kind of background checked and certified. And it's not necessarily the right term to use, like a background check or anything, but we've pretty much already contracted with them with that Imagine Health network. So feel free to use that website I put in the chat. This Imagine Health network is going to operate underneath that, or I guess with that HealthScope plan.
And the Imagine Health are the tier 1 benefits, correct?
Correct. Yeah. So on the Imagine Health website, you should be able to kind of jump on there. That website's also in your benefit booklet, I believe.
Yes.
You can jump on there and see different facilities and providers that we work with in your area if you do find yourself in one of those footprints. And then what I also meant to say is that if you jump on that website and you're not seeing your provider, don't freak out. It's like Mackenzie said, 9 times out of 10, it's because that provider just either isn't necessarily in network, but will still build a plan just fine, or they're just not in network yet. So if you have to go to your provider's office and they have more questions about how they can work with the Health Scope plan, that's when you can go ahead and call the number on the back of your ID card, get us involved, or just let them know, hey, you have benefits through Health Scope, and they can go ahead and bill that with the claim filing address in the back of your ID card. Hope that helped, but let me know if there's more questions.
Thank you, Nate. I'm going to go ahead and move on to the dental plans. The dental plans are not changing this year. There is one note that's important, and it's in red. If you're in Hawaii, do not enroll in the DHMO dental plan. No provider will accept it. Hawaii is difficult with networks in general. So if you're going to enroll on the dental insurance, choose the PPO plan. You'll most likely have to pay this out of network benefits, but at least you'll get reimbursed. And it matches your in-network benefits. So those benefits, you do not, if you see an in-network dentist, you do not have any deductibles. You do have a $1,500 maximum. And dental insurance works differently than medical insurance. So medical insurance, all of those numbers on the graph show what you owe before your insurance carrier starts to pay. For a dental plan, this number is what the insurance plan will pay, and then you have to pay for the rest after that. So you'll have a maximum coverage of $1,500 per year. For your preventive visits, those are always going to be covered at 100%. Those are things like cleanings, exams, fluoride treatments, sealants, space maintainers. Your basic services, you'll pay 10%, and UHC will pay 90% of the cost. So those are things like oral surgeries, composites, any like periodontic, endodontic services. And then for your major services, that's going to be like crowns, dentures, prosthetics. You'll pay 40% of whatever the cost is, and the dentist will pay 60%. Orthodontia is covered under this plan, but it's for children only up to age 19. That's 50%. You'll pay 50, the carrier will pay 50, and you'll have a lifetime maximum of $1,000. So if one kid has braces, you get $1,000 for that one child. If you have another kid, they also get $1,000, but they don't get any other coverage after that for orthodontia. So you have up into that amount before you have to pay the balance. You're out of network, you will have a $50 individual deductible and a $150 family deductible. Your annual maximum is the same as in network at $1,500. The 3 buckets are slightly different for basic and major services. Your preventive will be covered, but your basic services, you'll pay 20% of the cost after you pay that $50 deductible or $150 deductible. And then for your major services, it works similar, but you pay 50% of the cost. And I want to repeat this again because it's really important. Hawaii employees cannot enroll in the DHMO plan. The way a DHMO plan, if you're not in Hawaii and you do want to enroll, it's good to know that this is a very narrow network plan. So there's not a lot of dentists that accept this plan. And if you do enroll in this plan, you'll have a benefit schedule. You can ask your HR team for that. It'll show you the copays for each service that is covered under that plan. So it works a little differently than the normal PPO dental plan. Do you have the PPO plan? I'm assuming you do because you're only supposed to be on that plan. If you do, then yes, you can keep it. Okay. If you're on the PPO plan, you should be fine. We've done due diligence in the background to make sure that no one is on the DHMO plan, but you know, sometimes one gets slips through. So if you are on the DHMO, just let us know and we can get you, make sure to enroll in the PPO plan if you're in Hawaii. For your vision, this is also not changing. It is the same as, okay, yeah, then you're good. You can stay on that plan. Vision is not changing through UHC. $10 copay for exams, $25 copay for materials. You can get an exam once a year. You can get lenses once a year, and you can get frames every other year, so every 2 years. But I believe that if you choose to get lenses, you cannot get frames in the same year. So you got to choose one or the other. You, for frames, will have, I'm sorry, was there a question? Okay. For frames, you'll have a $130 allowance. So you will be covered, UHC will cover the $130 for the frames. And then any balance after that, you'll have to cover that. Same with formulary lenses and non-formulary lenses. You have a $150 allowance. So UHC will give you $150 towards your contact lens allowance, and then you'll have to pay anything over that. We did get a question last time about LASIK. Typically, most carriers cover or give some sort of like discount for LASIK. That's going to be a question if you call UHC, they'll be able to tell you what that discount is. I don't know that off the top of my head. And then Vision does have out of network. You're never going to you're always going to pay more out of pocket going out of network, but it is available to you if you need it. And it's a reimbursement amount. So you'll get reimbursed up to $40 on your exams, $45 on frames, things like that. So just know if you go out of network, you are probably going to pay more out of pocket. And these premiums are not changing for the new year. So whatever you paid last year is what you'll pay this year as well.
And when Mackenzie said you can't get lenses and frames on sale, she means contact lenses and frames.
Yes, sorry.
You definitely get the lenses in your glasses.
Yeah, if you get frames, you can get lenses with the frames. That would be crazy.
Yeah.
Sorry.
So the frames are every 2 years. That's good. You know,
yes.
Use the in between year to get your contacts.
Yes.
And use your FSA card or HSA card to pay for it.
Yes. Thanks, Donna. Basic life and AD&D and voluntary life and AD&D are staying with Lincoln. Nothing's changing here. For basic life, you get a $50,000 benefit. It's important to make sure your beneficiary is in UKG. This is something that you can change throughout the year, but it's better to do it now because if something were to happen to you, you wouldn't want to put that stress on your family members to try to figure out like how to get money, where to go, who to talk to. So it's just better to be proactive and make that update right now. And then if you need to change it throughout the year, you can. You also have access to voluntary life insurance. So if $50,000 is not enough for you, you can elect more coverage for yourself and your dependents. You can elect coverage in $10,000 increments to 5 times your base salary or $500,000 max. With this, new hires get a guaranteed issue amount of $150,000. And what that means is you can automatically enroll in $150,000 with no medical questions asked. If you're currently enrolled or you chose to waive optional life last year and you want to enroll this year, you will get a guaranteed issue of $20,000. And then if you want to enroll in more, you have to answer oh my gosh, I'm blanking. Basically a medical questionnaire. Evidence of insurability. Yeah. So you'll have to fill out that form. It's just a medical questionnaire, making sure that you're not on your deathbed and trying to get more money. It's pretty simple to fill out. If you enroll in optional life, you can also enroll your dependents, your spouse, increments of $5,000 to 50% of your amount, and that's to a max of $250,000 for your child or children from birth to age 19 or 25. If they're a full-time student, you get a flat amount of $10,000. And then your disability plans. These plans are important. If you go out on disability, this covers a portion of your income. So when you go out on disability, your bills don't stop coming in. They're going to continue to come in, but you're not going to have that income from your job. And so you need something to help cover that and, help pay your bills, help feed you and your family. And that's what short and long-term disability does for you. Short-term disability is available to everyone the first of the following month after 90 days of employment. This will kick in after the 7th day of whatever your illness or injury is. So you have that waiting period of 7 days, and then you'll be paid 60% of your weekly earnings to a max of $1,200 per week. And that benefit duration will last 13 weeks. If you're also enrolled in long-term disability, those benefits will kick in typically right after your short-term disability ends. It's a 90-day waiting period, I believe. And that pays you 60% of your monthly earnings to a maximum of $6,250 per month. That benefit duration, you can be enrolled in you can receive long-term disability benefits until your Social Security retirement age. Lincoln is also offering the EAP program again this year. This gives you personal guidance, and it also covers your family members. So each person gets up to 5 sessions with a counselor, and that's per issue per year. So issues are examples of, let's say you need to talk to a financial advisor. That's an issue that counts. If you need to talk to a lawyer, if you're getting a divorce, or if you're getting married, if you need childcare or elder care, you can have up to 5 sessions with a counselor, and then you also get 1 session in person per legal issue with a lawyer. So that's a 30-minute session. And this plan is free of charge. It's included with your other benefits, so you and your family members will have access to this as well. You also have access to a voluntary accident plan. This kind of goes hand in hand with your medical plan. It provides you a lump sum cash payment, and that's directly to you. So Lincoln will mail you a check, and that's for any things. So let's say you go to the doctor because you broke your arm. As soon as they see that claim hit, they'll automatically reimburse you. Let's say it's a $500 benefit. They'll send you a check in the mail for $500. So you can use that $500 to pay those medical expenses, or you can use it to go shopping. You can do whatever you want. But this is a voluntary benefit, so you will pay a premium per paycheck, and it's very low. And those premiums are in your guide. Same with the critical illness plan. You'll get a lump sum payment for any type of diagnosis, such as cancer, heart attack, stroke, kidney failure. There's much more, but these are just a couple examples. So if you are insured under this plan, you may have a waiting period or some pre-existing condition limitation. But if you do not, you'll get an immediate, like let's say you get diagnosed with cancer, God forbid, let's hope not. But if you do, you'd get a lump sum for getting a diagnosed with cancer. Maybe that's $10,000. And then you also get certain amounts if you have to do treatments and what that may be. So you get multiple lump sum amounts for that. And then typically people use that to pay their medical expenses, but you don't have to. The 401k retirement plan, that does not go through us. So I don't have a lot of information on it, but I do know it's not changing. It's the same as it was last year. You can only participate if you're 21 or older, and if you're not covered by a collective bargaining agreement, if you're a leased employee, and if you're a non-resident who does not receive any earned income from your employer. So that's through Schwab. If you need to enroll in that or make any updates, you can go online to astratus.com, and you can also set up your beneficiary on there, which I highly recommend doing. Finally, we're at next steps. So if you'd like to make any changes to your plans, or if you want to enroll in the plans, go to UKG, click on the Myself tab and the Contacts tab. There you can add any dependents if you want to enroll them on your plans. You will need to have their social security number, date of birth, and gender before moving on to the next step. And then you can also add in your beneficiary. Once you're done with that, you go to open enrollment, and then it'll take you through all the prompts. So you either go through the prompts and enroll in the plans, or you can click decline benefits. And I believe it'll say that for each plan. So like if you want to enroll in medical, but you don't want to enroll in vision, you obviously have that opportunity, and it'll take you through. And then at the end, you'll submit it, you'll get a summary, and that'll be sent to your HR team, and they'll review it, and then you'll be good to go. Any questions? I know we lost some people. It's been a long time, but we're staying on here for anyone who has any questions. Feel free to raise your hand, put it in the chat,
yeah.
or come off mute.
Okay, we have another question
Hey.
here.
Yeah.
Lindsay's asking, rewinding a little, sorry, under the UMR PPO high deductible health plan, when it says 35% after deductible, what about before the deductible?
So that basically means you'll have a contracted rate with that provider, and you can either call them before you go see them, or if, let's say, you're sick and it's a last minute thing and you just show up, you'll say, hey, I'm on a high deductible health plan. What is your cost share for that? Or what is my cost share for that? And they'll tell you, and it's typically, I don't know, anywhere from $150 to $250. It could be less, it could be more, but it's going to be different for any primary care or any specialist care provider you see, given the fact that it's a negotiated rate per contract with your carrier.
And generally with a high deductible health plan, you're going to be paying for all of the contracted costs up until you meet that deductible. And a lot of times they will bill you for that because they don't know what it's going to be up front, what they're going to get paid. So if you can just wait and let them bill you, that's what I do with my high deductible health plan.
Same. Yeah. Yeah. Like we're both on high deductible health plans. And for example, I had to go to a specialist visit this year or last year. I can't remember when it was. And I typically go to women's care. But if I were to go to a different gynecologist for my specialist visit that's not under women's care, instead of me paying, let's say it was $100 to see my gynecologist for my annual well woman, if I went to a different provider, they might charge me $150. You just don't know because it's a high deductible health plan, and every provider is different.
Mm-hmm. And then we have a question. If you want to stay in the same plans, are they going to cost more this year?
Yes. So there are a couple plans that cost more. Those are going to be your UMR plans. The Kaiser plans as well are increasing a little bit, and then I think that's it. I think the dental PPO plan is increasing a couple dollars, but not too much. But those costs are in your benefit guide as well. No problem.
Thank
Any
you.
other questions? Yes.
Yeah, I've been waiting for I guess the beginning. So what's up with 'cause I saw UMR had like a maternity care program.
Yes.
What's the maternity care for Health Scope RBP copay
So
for
that's
that
going to be
one?
the same program.
Okay, so when it comes to like pregnancy and like
Yep.
stuff like that, and getting like scans and all that,
Uh-huh.
because I know that could be expensive. I wanted
Yeah.
to know like if Geisinger or what's the name of the other place? Or Commonwealth Hospital. They take this
Um,
insurance.
I'd have to check on that. I don't know off the top of my head. Are you able to email those providers and their addresses to your HR team so that they can forward it to us? Because the more information we have, the easier it is to verify.
There are a lot of providers that have common names, so we have to make sure we're specific as well.
Yeah, I was curious, how would I contact somebody from HR? I'm on my I guess my InvoCare
Okay.
page.
Do you
Is it
typically talk to Donna Orlando for anything or Chelsea Chapman?
Oh, Don. Yeah, I haven't.
Yes.
I talked to Don and I speak to I'm sorry, Tara.
Yeah, so either of those people, if you just say, hey, can you forward this to our broker to get the Gallagher team, they'll be able to forward it to us and we can do that research.
Okay. Yeah, 'cause obviously I want to pick the right insurance for
Right,
not really
yeah.
trying to like get slapped. Like somebody said earlier that they had all these bills coming in
Yeah,
because of the RBT, and I was looking at the RBT,
yeah,
which obviously we're relatively healthy people,
yeah.
so I was looking at the first option, but the third option would be better because at least that one is a straight up copay.
Yeah, for
Compared
certain
to the tier.
services, you'll have a straight copay, but for some, you may have to meet your deductible. But that's like any other plan, even on the UMR
Yeah.
plans, there are
And
services like that.
with I guess with that tier 3, let's say we are paying, does that go straight to the deductible too, or is that for a
Yes.
different insurance? Oh, it goes straight to the insurance, as in like it goes into the deductible.
Yes, that's correct.
Okay.
Yep.
And the
All right.
maternity care program, it's a side program that gives you extra benefits, like resources and information and guidance, that kind of thing. So it's just it's an extra
Yeah.
benefit for you.
There's a team. So let's say your partner gets pregnant and you have to go to the doctor and there's a claim. HealthScope and UMR, depending on what plan you are, they have a team that's dedicated to analyzing those claims. So once they see that someone's pregnant or, like going through IVF or something like that, they will
Yeah.
automatically put that in their system and then they reach out to you. So I believe they'll send you a letter in the mail and also send you an email and call you. But I think if they can't get a hold of you within 3 tries, they'll reach out to us and then we'll figure out a way to get in touch with you. But typically they try their hardest a couple different ways to get in touch with you.
Okay, cool. Yeah,
Yeah.
I felt like that was like one of the main ones because
Yeah.
we want to try a few things next year, and
Yeah.
we don't want to get, like I said, we don't want to have like surprise bills and stuff that could like
No, yeah, I
make it
totally
stressing
understand.
during
Yeah.
that time.
Right.
So I've been working for the company. I'm assuming I should be making about a month
Mm-hmm.
coming up.
Okay.
I think they had told me that I needed to do 2 months or something like that to like enroll,
Yeah,
but
so so you have 2 months to enroll. So the day you get hired, you can look at those benefits and you can make your enrollment. They just won't be you won't they won't be live until 30 days after you get hired. Does that make sense?
No, so I could pretty much get I should be at my 30 days, pretty much hitting
Yeah.
very
So
soon.
so you can wait. You can either make your elections as the day you get hired and they give you the benefit packet, or you can wait until that 30th day and then you have 30 more days from the day you're eligible to make those decisions and elections.
So would that be I'm sorry. Would that be what you call it when you have a new, would that be like a new life event? As in,
Yeah, so, well, for you, it's not, I guess it is sort of a life event, but because you're a new hire, it's just your eligibility date. But yeah, that's technically a qualifying event, but they already know that in the system because I'm pretty sure that UKG notifies the HR team when someone's eligible for benefits. So
okay.
I always recommend doing it as like quickly as possible, like as soon as possible, not as quickly, but just so
Yeah.
that once you get to that elect eligibility date, so like the 30 days after you're hired, just so you don't have to scramble and try and make sure that you're enrolled in insurance. If you get a packet the first or second day or week that you're hired, it's best to obviously try to figure out what you want. That way you don't have to worry about doing it at the last minute, if that makes sense.
Okay. Yeah, because
But you
I
do
just
have
checked.
that option.
I got hired 11/19. So
Okay. Yeah. So it would be uh 11/19.
like
So
12/20.
yes,
It'd
but
be
I think it goes to January 1st because it's the first of the month after 30 days. Wait, I'm gonna have to
so
look
like
into that because
yeah, because I also like the other one a mess, like getting on insurance that way. Yeah, I can
yeah.
make my choice. So I see in my Invo Care, I guess open enrollment. I
Yeah.
could click on the description and it says
Yep.
employee open enrollment, my name, some number, and then I
Uh-huh.
guess it says about open enrollment. Then I was looking down, it says verified beneficiary dependent. So that's like
Uh-huh.
if start picking what insurance I want, right?
Yes, yeah. So when it's asking you for dependents, so if you want to enroll your partner or your spouse or whoever that is, you can that there you'll put in their information, and then for beneficiaries, you should if you're well you're automatically going to be enrolled in basic life insurance, but it's important to put your beneficiary in there because if something were to happen to you, they would immediately
Yeah,
get
they'll
paid
get it.
directly. Yeah.
Yeah, yeah.
So
Instead
yeah,
of going to
that's
like
the start
the
of
city and stuff.
enrolling, and then it'll take you through the prompts for all the other insurance.
Okay, so
I
this is the
also,
right page
um,
to enroll, right? Because it says
Say
confirm
that
your
again?
elections or changes. So this is
Yeah.
the enrollment page. Yeah, just making sure. I
Yes.
didn't know there was like a different page to like
No,
enroll.
no, I
So
think that's it. Yeah.
okay, so I'll just wait it out and I'll do it I guess December 19, 20, and I'm assuming it'll still be there because I know it says this the open enrollment session close date is 12/14/2025, but I'm assuming it'll
Yeah.
still be there for me.
Yes, it'll be active for you since you're a new hire.
Okay. Oh, okay, cool. Yeah,
Yeah. Yeah.
I just wanted to make sure. I just didn't want it to
Yeah.
disappear and then
No
like you
worries.
know. Um,
okay. Oh,
no, you're
Do
fine.
you have
Yeah, you could.
any
oh,
other questions? Okay. Sorry,
and
go
I'm
ahead,
sorry. I
Therese.
also had a question, just in
No,
relation
that's okay.
to the beneficiary. I noticed when
Yes.
I was in the screen, it asked you whether that person is the primary or secondary. Do they want a phone number? There's an additional box where it looks like they want some additional information. Do you know what information that is when you're dealing with the
So-
beneficiaries?
I don't know UKG specifically, but I'm just thinking about when I enrolled in my benefits. I believe I put the name, first and last name, what percentage I wanted. So for me, I put my mom and I gave her 100%. But like, if you wanted to put, if you were married, like you would put your spouse and you'd put 100%. Or if you had
Okay.
dependents, you could put 50% for your spouse and 50% for your child. That's totally up to you. And then I think you, if it doesn't, if it lets you move on, then that means you don't have to put any contact information, but it most likely will like notify you if you have to do that.
Yeah,
Oh,
and
okay.
typically they might ask you for the relationship or a phone number or
Yeah.
even sometimes the social, but date of birth. They just want some identifier so that John Smith, they want to know which John Smith it is. So they
Yeah.
need some kind of identifier to make sure we get the right one.
Okay. All right. Thank you.
No problem.
Someone asked,
And-
are there any out-of-network benefits for HealthScope? My worry is that no one is going to know what this is and like deny it. Then I get stuck with an out-of-network bill.
No, there are no out-of-network providers. If you, for some reason, go to the provider's office and they try to turn you away, I always recommend having them call the number on your ID card. You can go see anyone. That's not to say you won't get pushback, because you might. But from our experience, and this is not including the people who have had trouble but haven't reached out to ask for help, the people who have reached out to ask for help, we've been within like a couple minutes, 10 to 15 minutes, been able to call their provider and verify the coverage, and it's been fine. So that's why I recommend kind of doing your due diligence before you see the provider and making sure, like, hey, this is my insurance. If you are telling me you don't accept it, can you just please call this number to verify? Because this doesn't have a network, and like they tell me I can go see any provider, and typically that does it. You will always run into those front desk people that don't really care or don't want to do the extra work. With that, you'll just have to push them more, honestly. I know it's frustrating, but for the most part, I feel like people have been fine. We haven't had a lot of disruption in this year. Like it was at first, but it really quieted down throughout the year. So I would just recommend doing your due diligence before showing up to your doctors. So like this week or tomorrow, call the current doctors that you have and say, hey, I'm thinking of switching to this insurance. Can you call this number? And it's in your benefit guide. Can you call this number and verify the coverage? And if they give you pushback, just keep pushing them more. And
And then
then
one,
if
one
you,
last question, if you keep everything the same, is the enrollment automatic?
yes, it is. So if you don't want to change anything, you don't have to do anything in UKG.
Okay, thank you. I'll double check that I want to keep everything.
Okay, awesome.
Thank you.
Of course. All right. It's late where I am, so hopefully it's not late where all of you are. If so, I apologize. I'm gonna shut this down, but there is one more meeting, and that's on Wednesday night. So if you still feel like you need to ask questions or need to understand it more, you can always go on to the next open enrollment meeting on Wednesday. If not, the recording has been sent to Donna Orlando and Chelsea Chapman. Please request them to send it to you if they haven't already, and you can listen to the recording there. But I appreciate everyone for hopping on and spending the time to learn about your benefits, and hopefully you guys feel confident. If not, let us know if you have any questions, and I hope you guys have a good day or night. Thank you.
Thank you. You too.
Thanks, guys.
Have a good night.
You too.
Thank you.